Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai. He is a psychiatrist and internal medicine physician. Today's Kevin MD article is When Rock Bottom is a Turning Point, Why the Turmoil at HHS May Be a Blessing in Disguise. Muhammad, welcome back to the show.
Thank you for having me to talk about this timely topic about the U.S. Department of Health and Human Services.
All right, so tell us what your article is about.
So, my article talks a little bit about the current situation that is happening at the United States Department of Health and Human Services. And I want to tell your audience, as a full disclosure, I worked for the United States Department of Health and Human Services. I was a federal employee at the National Institute of Mental Health for about 3 years early on in my career. So I consider myself as an insider, and I can give people just an idea about kind of the changes. There's a lot of political winds with the changes in the Department of Health and Human Services, changes at the National Institute of Health, changes at the Centers for Disease Control and Prevention, changes at the Food and Drug Administration, and with significant layoffs and significant reshaping of these federal agencies, there's a lot of angst, a lot of discomfort from the physician community, number one, from the federal employees who are being laid off, and from the American public and the patient population. So everybody is uncomfortable, everybody's anxious about this situation. But I see it as a situation where there may be a warranted correction in our course, and that this may be a blessing in disguise, and that we may have some positive outcome from this situation, even though there's chaos and turmoil at the Department of Health and Human Services, but that basically we need some change, and that we definitely can benefit from a significant course correction in what's been going on in the health situation in our country.
All right, so before talking about that course correction, just to lay out some context, what are you hearing about some of that angst from the public, from physicians regarding the appointees of this new administration to Health and Human Services? What are you hearing in terms of some of that pushback?
So I mean, there's a lot of trepidations and there's a lot of reservations about the appointees, about their credentials, about their life experiences, about their preconceived notions, about their preformed opinions on a lot of health topics, and that some of their opinions that already preformed, that may shape the health policy in our country. The Secretary for Health and Human Services has already confirmed, the Director for the National Institute of Health, the Commissioner for the Food and Drug Administration, the CDC Director. We have currently a pending appointment for Surgeon General. So there's a lot of concern that these are unconventional appointees, unconventional nominees that are being proposed for these situations or for these positions, and that they have already formed a lot of very controversial opinions that are public about a lot of topics, ranging from our food policy, ranging from our medication policy, to vaccinations, to positions about COVID and what has happened with the COVID situation. So sometimes some physicians think that these are not appropriate appointees because they don't have the credentials and the expertise. Some people think that they're appropriate. Patients are caught in the middle because basically they get a lot of information, a lot of opinion. A lot of people feel that the people who are being laid off or dismissed from these agencies, that they were attached to the status quo, and that maybe their dismissal would allow some changes in course. So we have a lot of conflicting opinions, and it's related to the political winds or personal aspiration. But my point is that we should let things play out, and maybe some change will come out of that. And we're going to talk a little bit about some of the situations that have
Mhm.
made people reach that conclusion.
So you said some of these appointees were unconventional, and you listed some posts. Of course, we're talking about Robert Kennedy, we're talking about Jay Bhattacharya, we're talking about Marty Makary. So these are the people that were appointed and confirmed to these posts. So you said that some of them were unconventional. What makes them unconventional?
I think they're kind of preconceived ideas, kind of their experiences, some of them defending some topics specifically for COVID that where a lot of people disagreed about vaccination, disagreed about the origin of the virus. For example, Secretary Kennedy, who does not believe in vaccinations for certain things and has certain preconceived ideas about the diagnosis of autism, which is specifically for me as a psychiatrist, and the fact that there's been an explosion in the phenomena of autism in this country. So just the fact that they have these ideas already coming into the position just makes them unconventional. And we talked about some nominees also. So we talked about the current nominee for Surgeon General, who is somebody who's not practicing medicine, who left residency, who has attachment to ideas about healthy living and not a lot of practice of conventional medicine. So that makes people who are in practice kind of uncomfortable about that situation.
So you said that you've had experience working in health and human services in your past. So tell us what you saw there that warranted some reforms.
Sure, sure. So, I mean, I working at the National Institute of Mental Health at NIH. I was in Bethesda. I saw a lot of great people. I saw a lot of devoted federal employees who were public servants who had devoted their life. They were brilliant. They were hardworking. They were caring for the public. But I also saw a lot of inertia. I saw a lot of people just being attached to the status quo, not wanting to change any positions in terms of what the outcomes are or what is how we can serve the public better. So I think that there was a lot of room for change from what I saw working as a federal employee. And I think that's what the public aspires to. At least that's what the leadership with the government and the president aspires to make some changes to what we are right now in terms of our health status. I mean, we are the sickest, wealthiest nation on the face of the earth, and I think that that is very, very significant.
So tell us what's been done in terms of some of the reforms that's already happened that you think that's moved in the right direction. What's already been done?
I think I mean, there's a lot of good things that are being done. I mean, I think just a reappraisal of what's going on and kind of just trying to re-understand a lot of phenomena. So, for example, we with the Secretary of Health and Human Services, his approach to trying to understand the phenomena of obesity in this country. I mean, we have close to 60-70% of individuals who live in this country who are considered obese. And so trying to address that and understand that phenomena, I think is very, very helpful. So he is moving in the right direction, even though people think that that's unconventional, that some of these thoughts maybe just out there and wild. But I think he's moving in the right direction. He's doing something different that has not been done before. And I think that that merits allowing it to play off and figure out are we doing things right? Because what we have done so far has led to this explosion of this epidemic of obesity, metabolic syndrome. Maternal mortality is very high. Our children's education and health education and physical education is close to nil. And so I think it's okay to have a Secretary of Health and Human Services who pumps iron and shows that he has muscles and promotes physical exercise for this country. So I think what I'm seeing so far is appropriate and is moving in the right direction.
So you mentioned when you were working at the National Institutes for Health, a lot of dedicated civil servants, a lot of brilliant people, as you said yourself there. A lot of these people, as you know, are getting laid off, right? And their funding and grants have been cut. So how do you address that human impact of these layoffs on what you describe as really dedicated, brilliant civil service with what's going on with a lot of them being laid off?
It's very hard. I mean, my heart bleeds for these colleagues who lost their jobs, layoffs, their livelihood is gone. I mean, but they as a civil servant, as a federal employee, They were stewards of the taxpayers' money. And I think that I put in the article some examples where the public's patience had expired. Early on in the COVID pandemic, the chief of staff for the Secretary of Health and Human Services did actually a survey, like Elon Musk asked people to send him an email once a week to tell him what they've done, just 5 things that they've done that week. They looked to see who signed in into their email, who signed in into their account at work, and they found that close to 50% of the employees in the year 2020 did not sign to their computer, did not sign into their computer. That's half of the department didn't sign in into their computer. So I think that the American public noticed that. And then on top of that, we had the baby formula issue where basically baby formula was not available because the CDC kind of was asleep at the wheels and they didn't get notices on contamination in some factories that were making baby formula. And so the shelves were empty. People had to scramble to get baby formula. And then the controversy about vaccines, COVID vaccines, and masking and public guidance and the distribution of vaccines, I think kind of wore down the patience of the American people with the health establishment and the Department of Health and Human Services. So a lot of the public sees that I mean, I know there's probably a lot of dedicated employees at the Department of Health and Human Services, but I think when you find out that 50% didn't sign into their computer, then you know that there's significant amount for improvement and that some of the layoffs may be appropriate to affect changes in the policy of that department.
Is there anything that you've seen from this new administration, and I know it's only been less than a year, that's given you a little bit of pause, a little bit of trepidation, making you think, hey, maybe this isn't something I agree with?
A lot of my colleagues have a lot of trepidations about the nominee for the Surgeon General, that she is not a practicing physician. She's going to become the head of the Public Health Service. I was part of the civilian corps of the United States Public Health Service. She has to be a practicing physician. She has to have a medical license. So maybe that may be an area where there may be pause for that, but only time would tell. Maybe she'll reactivate her license and lead successfully the public health service. I think time is too early for us to tell any changes. You know, with any health policy, there's no immediate results. And certainly it took us many, many years to get into this situation. Overdoses from opiates, public health issues with autism, no physical exercise with kids in school, the issue with obesity, maternal mortality. So there's a lot of issues that need a lot of attention, and some of the changes will take time. But for example, I think what's encouraging right now is, for example, banning of the artificial dyes in our food chain. I think that's very important. And some members of Congress said that they were working on it for many, many years, 20 years, and it's done in the first 100 days. So there may be some hope that we are seeing. Certainly, there's always, with the political climate, there's always room for people to be uncomfortable with what's going on. But I think that we need to give it time and to recalibrate and certainly to change direction with the Department of Health and Human Services, because certainly we were going in the wrong direction. So for people to say that we took the wrong turn already, we're definitely in the wrong direction. So any turn that we are going to take is going to be getting us to the right direction.
So, under your best case scenario, what would you like to see happen, or what do you envision Health and Human Services and its various umbrellas to look like at the end of this administration?
I think a revamping, for example, and I'll start with the National Institute of Health, where I worked, a revamping of the priorities. I mean, I think a lot of the priorities were actually toward more basic science research and away from clinically meaningful research. And I can tell you about my specific field, about my psychiatry. We basically do a lot of neuroscience, basic science research, and not a lot of clinical trials that will address how do you treat depression in the community? How do you treat anxiety in the community? How do you treat schizophrenia in the community? How do you treat bipolar disorder in the community? It's all theoretical research that's basic science and neurotransmitters, and not a lot of kind of meat and potato practice of medicine. And hopefully, that some of those research priorities and funding priorities are going to change to address real life questions that face the practitioner every day in the field of medicine. So I feel that with that repositioning, we're going to see a lot of clinical trials that address the real questions that we have in clinical practice. The Food and Drug Administration, I think, is very, very important. They're gonna need to focus more on patients and less on industry. We, the taxpayers, are their stewards. It's not the pharmaceutical industry. So they need to focus on that, and they need to address the grievances that the American public have with that. And then the CDC, I think they have a lot of work to earn the public trust, because the public does not has some doubt always now with messaging from the CDC. So I think they need to work very, very hard on regaining the trust of the public.
We're talking to Muhamad Ali Rifai. He's a psychiatrist and internal medicine physician. Today's Kevin MD article is When Rock Bottom is a Turning Point, Why the Turmoil at HHS May Be a Blessing in Disguise. Muhammad, let's end with some take-home messages they want to leave with the Kevin MD audience.
I'm very hopeful. I mean, we this is our country. I think change in the Department of Health and Human Services is overdue. Patients are waiting for it. They are counting on us. We, as practicing physician out in the community, we need to be receptive, and we need to be helpful for our Department of Health and Human Services to affect these changes that are going to serve our population and that are going to bring us back on the pathway to health, pathway to weight loss, pathway to serving our patient population, a healthy patient population, healthy kids. So I'm very hopeful. I think we're gonna have a course correction, and within few years we're gonna be happy with these changes that have happened.
Muhammad, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
My pleasure. Thank you.